Hi, it's the nursing professor here, continuing with March Madness. All right, so we're staying with the endocrine system, and today we're going to be talking about the growth hormone imbalance. And of course, that's going to be two different ways that imbalance can happen. Either you have too much or you have too little. So let's start out with talking about when you have a deficiency or too little of the growth hormone. Typically, we see this in childhood where children grow maybe 3 to 4 feet. We know it as dwarfism. Can run in families, so it can be hereditary, but also can be a result of a pituitary tumor, and in some countries could be a result of malnutrition. We don't see that here in the United States. So signs and symptoms also include fatigue, weakness, belly fat that covers these visceral organs, which of course we know how dangerous that is, hypercholesteremia, decreased muscle mass, decreased bone, sexual dysfunction is definitely a problem with this, and the risk for cardiovascular disease is quite high because you can imagine all that belly fat and the covering of the visceral organs that would contribute to that. Many times people have really poor quality of life and they have a shortened lifespan as a result of that. And so how we determine that a person has this is through blood work. Typically, the blood work is a test called the insulin tolerance test, where a person is given some insulin to see how their bodies will adjust to it. Many times it will really make the blood sugar levels drop really low. X-rays and MRIs can also be helpful. The treatment of this is administering very low doses of insulin-like. It's a synthetic type of insulin, which gives the person some growth hormone. It is usually administered subcutaneously because you only can give a little at a time. The body's very sensitive to it. And so pretty much that's it if a person has too little growth hormone. So let's look at if they have too much. So if they have too much of a growth hormone, many times we see the opposite. We see gigantism, where people are really, really big. Also acromegaly. And so the bones actually grow in width versus growing in height. So don't get this confused with, say, Addison's disease, because that's a whole nother ball game, which we'll talk about at a later date. So if a person has too much of the growth hormone, then typically you'll see the bones will grow in width, not in height. And also there's a problem with the organs and connective tissue because they start to overgrow as well. Causes of that is very similar. There's usually a problem with the pituitary gland. There's some sort of tumor or hyperplasia that happens with that. Also, it could be a hypothalamic dysfunction. Some of the signs and symptoms you might see is a change in shoe size. So we're talking about an adult. So they start to see their feet start to grow really long or really big, or ring size. That's also another way. Their teeth can start to shift because that area starts to grow, so the jaw starts to grow, and so many times these people can suffer from difficulty swallowing, even difficulty talking, because of this abnormal growth. Because remember, it's growing pretty fast, and our bodies are not supposed to do that. People can also suffer from sleep apnea, headaches, diabetes, arthritis, and also sexual dysfunction. And just like in having low growth hormones, a person with excess growth hormones can also have a shortened lifespan. So that's just something to put in your memory bank, because you could possibly see test questions associated with that. We will meet again tomorrow, and we'll talk about other thyroid conditions, which will include hyper and hypothyroidism. And so that's it for now.